psychosocial needs in cancer, which is, as I told you, an overview of the Romanian situation. I will start with something very recent. It was published last year in the EPAC project. It was a survey, actually, in, I think, all of the European member states about the psychosocial care. And actually, they were interested if the psychosocial care is included in the national cancer plan or not. And in case it is included, it is funded or it's not funded. What I just want to show you at this moment is that Romania is among only those few countries in Europe which doesn't have the psychosocial care included in the national cancer plan. And this is a problem. It's not even mentioned. So it's not included, but it's not even mentioned. So it doesn't, the words psycho and social do not exist in this cancer plan. And we have a cancer plan starting back in 1978. This is one of the issues. The other issue, which is a positive issue, is that the psycho-oncology and psychosocial care issues are gaining some kind of momentum in Romania. And I think it's good news, but the problem is still that the psychosocial care is not addressed officially and there is not included in the standard care. You have to know that in Romania last year we had something like 74,000 new cases of cancer, and something like 56,000 patients died last year because of cancer in Romania. And it's estimated that something like 5% of the cancer patients receive some kind of psychosocial support at the moment in Romania. And this is only an estimation. And of course, we are not speaking about families and other diseases because it affects almost 4.5 million people in Romania. The data we are going to show, I'm going to show you, is from the project called EBSCO. This project is the first project in Romania about the screening of psychosocial issues, needs in cancer patients. And we screened patients not only in the oncology institutions, but also in supportive care groups and in palliative services. And what is very important is that last year we also included not just patients, but also professionals working with cancer patients. So the aim of the EBSCO project is to explore and examine cancer-related distress. And of course there is a kind of specific but not really bothering issue anymore, but there's a specific situation about cancer diagnosis, non-disclosure in Romania. So the issue is about cancer distress and in the background of cancer diagnosis, non-disclosure. We started in 2001, and actually we are working with a repeated cross-sectional design. It means that we had a second wave in 2006. It was 1 year before Romania joined the European Union. Romania joined the European Union in 2007. And we had a new wave in 2014, last year, after 7 years, joining the European Union. Because, you know, when we joined the European Union, we expected that signing all the papers and documents would really mean and make a difference. But as you are going to see, at least when we're speaking about psychosocial issues in cancer care, they didn't make any difference. And as I told you last year, we also included the first assessment from the perspective of specialists. We have had not only questionnaires but also interviews with them, something like 158. These are the instruments generally we use. I won't go very deep into that. We are using FACTG, BDI, STI, and so on. But what is more important that in 2013 and 14, actually we have used for the first time the emotional thermometers tool, because we realized in so many years what are the So I learned and realized that we need also very synthetic, very simple and very reliable instruments. So we have the translation and adaptation of the Romanian or Hungarian version of the emotion thermometer tools. And what is I would say the news for this year, that based on this thermometer we have developed, actually the application is already finished or almost finished. There is an application we are going to use based on the emotional thermometers, which acts like a self-monitoring tool application for cancer patients and for their relatives. But because it also has a database in the background, it can be used by specialists working on tablets or whatever with cancer patients. But for the cancer patients themselves, there is a source of organizations and services. So the application monitors your distress, and when it's high, it gives you just access to resources. It has actually a resource, it has a database of resources for all the services, psychosocial services that are in Romania at the moment. So, yeah. When we are talking about results, I'm going to show you actually in two parts. The first part is going to be about results from the patients, and after that we are going to see results from the specialists. And as I close this presentation on cancer distress and psychosocial needs, I'm going to hand over to Eva to have the interventions. Also, a very new, very recent declaration of the new IPOS president, Lucia Travado. She says that here, where there are no psychosocial cancer care services available, doctors tend to be more silent about the diagnosis, and I would say mostly about prognosis. Doctors have more confidence in disclosing the diagnosis to a patient where there is a psycho-oncology service in place to refer patients to it. So, and I think she knows the situation very well because she was here at least 2 times and we had training together with IPOS here in Romania. So, we start with cancer diagnosis, no disclosure. And I think we can start with good news, some kind of good news. When we see a trend of cancer diagnosis, no disclosure from 2006 up to 2013-14, we see actually that the trends are down. Actually, when we are looking at the percentages, we are going to see that almost it halved in the last 7 years, which is quite a good news. So in 2006, something like 17% of the cancer patients were not informed about their cancer status, though there is a law, of course, that they have to be informed. And in 2014, something like 8% of the patients. So there is a positive change in that, and I think this is good news. But when we take a look to the clinically significant depression symptoms, and we take a look at anxiety symptoms, you're going to see, you don't see probably the numbers back there, but I think just if you are looking at the dots, you will see nothing really much changed. So I would say that one cancer patient out of 2 is suffering from depressive and anxiety symptoms, which are burdening their life. This is quite a high rate, I would say. And if you take a look at the quality of life results, we are going to see the same thing is happening. So we see here the global quality of life and the 4 domains of quality of life: physical well-being, social well-being, emotional well-being, and functional well-being. There hasn't been too much movement in this quality of life issue either in the last 7 years. Here we are going to see all the factors together, moving together, just to see the trends. And yes, the green dot is quality of life, the global quality of life, physical well-being, emotional well-being, functional well-being, and social well-being. And in the middle, we are going to see And cancer diagnosis, non-disclosure, yes. And in the middle, we're going to see the anxiety symptoms and clinical depression. And now you are going to see how do they move like a trend from 2006 up to 2014. And at the end, you will see that the only big change is what we already have spoken about. It's the cancer diagnosis, non-disclosure, which is going down. But the other parts of quality of life and anxiety and depression are actually into place, are around at the same level it was in 2006 and 2007. As I told you, we do not only screen and make research with patients in the hospitals, but also with patients from the supportive groups and palliative care. So in 2009, we had a comparative analysis, which was published, and we were very interested to see how is their quality of life when we compare this. And you can see that the yellow is the hospitalized group, the green is the supportive group, and the red is the palliative care group. And here are the domains of quality of life. And of course, it was controlled for confounding factors, but what we have seen is that the only significant differences, I mean statistically and clinically meaningful differences, were in physical well-being and functional well-being, which is of course logical, but we haven't seen any significant differences between social well-being and emotional well-being. So it really does, it seems that it really does not matter if you are in active treatment, outside, survivor, in survivorship, or in palliative care, the burden of psychosocial issues, it seems that it's almost the same. And of course, we have asked about the burden of disease. What is the impact of disease upon the areas of your life? This is the WHO, and we have health, diet, work, recreation, financial situation, partnership relation, sex life, family relations, social life, self-improvement, religious expression, and civic involvement. And we are going to see that after health, the biggest burden, the biggest impact is on paid work. Actually, this is what we have rated. Yes. So, I think that in Romania, the psychosocial needs are all at the same time very high, and also, I think this is a vulnerability because unsolved psychosocial needs burden both the patients and also the services. And I am almost completely sure that if the system doesn't give a chance by using screening and integrating cancer distress screening in the routine care, then we do not have a good beginning at all. So I think that the sixth vital sign, which is in the standards of the IPOS and quality cancer care, should be a good start here, or should be included in the Romanian practice, of course. And for those who are not familiar with the sixth vital sign, it's the message actually of IPOS, which says that after breathing, pain, temperature, blood pressure, and pulse, cancer distress could be the sixth vital sign. And now I'm going to show just a few results about what it feels to be a professional in Romania working with cancer patients. This is the first time that somebody asked them about it, and I just going to, we asked so many things, but I'm going to only share some of the results which are most important at the moment. One of the things I asked if they have any supervision at their work. I mean, even for me, even knowing what's happening in Romania, I think this is too much. So 85% of them said that they do not have any kind of supervision at work. I mean, and this is just, yeah. And another one, which I think this training is going also to help us, is that when we ask the professionals, if they use any standardized psychosocial tool or protocol, almost 58% said they do not use any kind of protocol or psychosocial assessment tool, which is again very troubling. But when we ask them if they want to have further training in this field, psycho-oncology and psychosocial care, you will see that actually more than 90% said that they would moderately very or extremely likely would like to have further training. Also, we think that we need professional bodies and societies to work on these issues and to have their background. And of course, we have the Romanian Psychology Society, but check who is member of this society, almost nobody. So, and also we have not just the research project called EBSCO, but we also have an association, which is called in English, the Romanian Association for Services and Communication in Oncology. These are the two keywords we really think should bring kind of change. So communication and services, and we mean first of all psychosocial services. Yeah. I think that we still need support, and I think that we still need to strengthen, and I also think that the Romanian, usually the Eastern European situation is different, but each country is so very different in this area. So, for example, in Romania, I think the needs of cancer patients and professionals in psychosocial care have to be promoted and studied in a multicultural setting. If you want to know more about results, our work, and whatever, you can access our website. This is psychooncology.ro. It's in English only, so it won't be a problem to have access to data and results. And of course, I have to tell you that our work is supported by the Romanian National Authority for Scientific Research, which is very important. They are backing up this kind of projects in psychosocial distress screening and care.